Did you know that with good lifestyle, you can actually recover from stroke? Hello, our dear viewers. I'm your physician, Dr. Andrew, and you're welcome to our YouTube platform, Health Tips and Tricks. And if you are new to this channel, kindly subscribe so that you continue receiving our health tips and tricks to help you live a healthier and more productive life. Today, we are still talking about brain function, and today we are going to talk about recovery from stroke. Most of us know about stroke, and for those who don't know about it, you can check our platform. Previously we have learned about stroke and what it means. But to go to today's talk, so stroke, as we talked about in summary, it is basically a condition where your brain cells are affected in such a way that they can no longer get perfusion and nutrition, either because the blood vessels are damaged or because there is bleeding that has happened in the brain. And when this happens, it causes sudden onset of loss of function, most times motor function. So if a patient has recovered from a stroke, or if you have a relative who is on his way to recover from a stroke and has been maybe discharged from the hospital and they are now in rehabilitation, what are some of the things that they can do which can help them to recover either completely from this stroke or to recover to a really good extent from this stroke? So one, we shall talk about exercises and physical activity. So this is very important, and that's why even in hospital, the doctors or your physician will emphasize early initiation of physiotherapy, because exercise will enable the muscles to do activity, and once the muscles do activity, they will stimulate the brain to also recover. Okay? So we have also minimizing risky lifestyles. For example, smoking. Smoking, we all know, is already detrimental to the blood vessels, and these blood vessels are the ones bringing nutrition to the brain. So by reducing smoking, you also improve nutrition of the brain. And of course, with smoking comes also alcohol, which is also detrimental to the brain cells. So by reducing your alcohol consumption, you're protecting your brain and enabling it to recover from the stroke. Then we have weight control. So a post-stroke patient is supposed to also watch their weight, and this can be done through physical activity, like we have said, but it can also be done through diet, feeding on diet that is not high in fat content and feeding more on food which is from plant products. So this will help check your weight, because once you lower your weight, you'll have proper energy utilization, and this will help you to have a healthy brain. Then we have lowering your cholesterol. Cholesterol is a certain type of fat in your body that is important. Your body does need it because it composes a very important constituent of all your body cells, including brain cells. However, in excess, this cholesterol can be detrimental. It will be deposited in the blood vessels, causing clogging and obstruction, and can easily lead to reduced recovery from stroke, or even be a risk factor for you to get another stroke. So by lowering your cholesterol levels, this can also help you have proper brain health and recover from the effects of a stroke. Managing your stress. What is stress? Many of us go through different activities in life, different challenges in life, and all these cause what we call body stress. Your body has a way it responds to stress. And some of the ways it responds to stress are neurohormonal ways. What are these ways? These are ways in which the body releases certain chemicals in your body that will affect blood vessels, affect glucose management, and all this can be detrimental to your brain, which is trying to recover from a stroke. So by managing your stress, controlling your stress, you will be able to reduce some of these after effects. Another effect can even be a rise in the blood pressure that can also happen because of stress and anxiety. And the rise in blood pressure is detrimental because this is one of the precipitants of stroke. So if you are on your recovery way from a stroke and you're exposed again to high blood pressure, it can worsen your recovery. Then we have nutrition, which we have already talked about. Having a good nutrition during stroke recovery is very important. Previously, we have talked about some of the foods that are good for the brain, and we said some of these include fatty fish with rich in omega-3 oils, vegetables, leafy vegetables like spinach. We talked about avocado, which is rich in oil. We talked about blueberries. We talked about foods which are rich in fiber, like whole grains. So including all these in your diet will also help you on your way to recovery from a stroke. Then we have, of course, blood pressure control, which I have talked about. That to have a blood pressure which is within normal range is also important on your way to recovery from a stroke. And this may sometimes need you to visit your physician to have a machine which monitors blood pressure at home, so that you keep your blood pressure in that allowable range which has been recommended by your physician, and thus prevent occurrence of another stroke, and also fasten your recovery from the stroke you have suffered. Mental health is also very important. Sometimes post-stroke, these patients can have mental health issues. One, they can feel depressed because maybe they are unable to do something. So these people should see a mental health specialist, or a mental health specialist should be brought to them to help them have good mental health, which will also help them in the recovery of their brain. Even people around them can also be supportive, so that they help to improve the mental health of this patient. And then we have, of course, controlling of the blood sugar levels. Blood sugar, like we have said, is detrimental to your health, and diabetes, which is the disease of blood sugar, is one of the factors that precipitate stroke. So if you are diabetic, or if you're not diabetic, it is also good to have normal sugar levels, controlled sugar levels, feeding healthy, so that you reduce effects on the brain and enable it to recover from the stroke. Then, of course, visiting your physician. A patient who has suffered a stroke is supposed to have reviews from their physician. It can be monthly, it can be 2 monthly. Your physician will examine you, will look at your function, how is the recovery going, and will advise you accordingly on where you have to improve or where you have to change, so that you can be able to recover from the effects of this stroke. Then, of course, under exercises, sometimes we may not have privy to having a physiotherapist around all the time, but even at home there are certain light activities we can engage in, and these include both physical activity and mental activity. So what is the physical activity? These include things like training the limbs. For example, we said stroke commonly affects the limbs and the motor function. So you can have small devices like gadgets to grasp and press on. These can be helpful because they will strengthen your muscles, train your muscles, and in the long run, help in the recovery of your brain. We have activities like trunk rotation. If the patient is bedridden, unable to turn, this can be done by assistance from relatives or friends to turn their trunk, and this will train their trunk muscles, which will also help to boost the brain. Activities of walking. If a patient has reached a level where they can walk alone, or they can walk with support from a walking aid, this is also very important for their recovery from stroke and for the recovery of their brain. Then, of course, we have exercises like yoga, and these call for special people who have specialized in yoga training to help relax the mind and also relax the muscles and promote brain activity and help recovery from the stroke. Strength training. Sometimes we have to strengthen our muscles. The more you utilize your muscles, the more you stimulate your brain, and thus you will hasten the healing and recovery of your brain. But in all this, the patient must remember, or the relatives must remember, that the patient who is recovering from a stroke needs assistance. There has to be safety, and also there has to be a schedule so that there is consistency. If exercise is done, if nutrition is done well, and these things are dropped, the lack of consistency can also cause a decline. So there has to be consistency, and that's why there has to be a schedule which has to be fixed and met so that the patient can recover from the stroke. Then, of course, we talked about mental exercise. This patient should have visual stimulants, audio stimulants. Let them listen to the TV, watch the news with the rest, watch something interesting on TV, maybe a comedy show, go outside, look at nature, look at the trees, get some vitamin D from the sun, and all this will hasten and enable the brain to heal. Have friendly people around them so that they can listen to friendly conversation. All this will help in the recovery of the brain after suffering from a stroke. So in summary, we have looked at some of the ways in which a patient recovering from a stroke, or a patient who has suffered a stroke, can be able to hasten their recovery and also promote their brain health so that they have recovered from the stroke and its effects. Thank you very much. I remain your physician, Dr. Andrew, and thank you for listening.